Hey everyone, it's Wednesday, time for a little Wisdom Wednesday. Today I thought I would talk a little bit about high blood pressure. I haven't really covered that specifically in any of our talks in the last year or two. And this past week or so, we've really had quite a few folks walking in with just borderline and high blood pressure. So I thought I'd give you just a little small snippet of information about blood pressure and some things that we can look into that are things we can do prior to really having to go on any medication, although that's not the worst thing that can happen. It's really important to control blood pressure. We know that high blood pressure, and it's defined as blood pressure that's greater than 140/90, that 140 being the pressure that it takes to push blood through the vascular bed during a heartbeat, and then the diastolic, which is the pressure that happens when the heart is at rest and refilling. And whenever you go to the doctor or even the dentist, or certainly you can even get a cuff yourself, or CVS or Walgreens, you can get your blood pressure checked. And we're just seeing a lot of folks with these borderline pressures. And I think the thing to know is that even borderline pressures have some risk to them. We know that it can cause damage to the inside of blood vessels and cause them to stiffen up over time and increase our risk for cardiac events and strokes and increase for chronic kidney disease. So long term, this is not something to be taken lightly and something that really needs to be addressed. But know that there are things that we can do prior to having to go on medication. First of all, I think it's important that we all have blood pressure cuffs at home and know how to take a blood pressure. They're not expensive and they are decent in terms of the data that you get. And you want to just sit still for a few minutes and then check your blood pressure. Not something you want to run in from working outside and then throw a cuff on and check it. You want to give your body a little chance, but you do want to be sitting. And know that there's going to be some variation of blood pressure throughout the day. And certainly when you're exercising, blood pressure is going to go up, heart rate goes up. But just at rest, what is your baseline blood pressure? And you want to check your blood pressure different times of the day. You want to check it maybe once a week in the morning and maybe once a week in the afternoon or evening, just to see what this variation might be, what we call the diurnal variation throughout the day might look like. And just keep a little tablet by the blood pressure cuff and write them down. This is very helpful if we're just really looking to see, is there a long pattern? Is there a persistent pattern? Is it just cyclical? Does it come and go? So these things can be really helpful in order to try to figure out what to do. But some of the things that we can do is certainly exercise. We know that it's going to be good just to get your heart rate running and helping your vasculature to dilate and constrict just as needed for activity. Certainly we know that losing weight makes a huge difference if you are not at a good, healthy weight. And of course, we've been spending quite a bit of time in recent weeks talking about the semaglutide protocol or treatment, shot, injection, whatever you want to call it. And certainly, as I've said, we've been seeing lots of great results with that. And weight loss does have impact on blood pressure. It's just less weight on the body, so the heart doesn't have to pump quite as hard. We know that processed foods, in particular, eating a lot of processed foods, a lot of fast foods, can increase inflammation, which is going to increase blood pressure. So lowering inflammatory foods, particularly processed foods, sugars, and any types of fast foods. And of course, we're entering sugar season, folks. So I really do hope that the majority of the time you'll really take heart and so to speak, and really look at what you're doing from a nutritional standpoint. We know that there are going to be days throughout these holidays coming up where you're going to be thrown with family and you go to comfort foods, and we understand all that, but the time in between is really where you want to try to be consistent and eating a good nutrient-dense diet with healthy proteins, healthy fats, good vegetables, and really limiting sugars and sweets throughout this time period, because there's just so many opportunities that come your way through the next month and a half, 2 months coming along. The other thing, of course, if we know that smoking is a big risk factor, and fortunately we don't have a ton of smokers in our practice, but just knowing that that is a huge risk factor for hypertension. And then reducing stress. Now that's easy to say, but how does one go about that? Well, first of all, we know that having good tools and ways that you can lower stress is important. And people who have done meditation courses, people who know how to do deep breathing, people who are using high intensity interval training to help lower heart rate when it goes up to bring it back down can be very helpful. So these are ways that we're increasing what we call parasympathetic tone, which will then help to lower blood pressure, improve relaxation, and that relaxation of muscles also happens to be with the vasculature as well and can help lower blood pressure. We know that meditation and yoga are very valuable for this because of the breathing and Pilates as well. These types of workouts are very beneficial in addition to just doing cardio. There are also things like caffeine and dark chocolate that help lower blood pressure. We know that a hormone program, if you are postmenopausal or older as a gentleman and have reduced testosterone levels, that the hormone program actually does help lower blood pressure. There's great data about getting good restful sleep. And you know, we talk about all of these things. These lifestyle aspects are so important as far as getting good results with managing blood pressure. There's a wonderful medicinal herb product called Carditone that we've had great success with. I don't have a bottle with me to show you, but Carditone, Carditone. You can buy it over the counter. It's not very expensive. 1 or 2 tablets a day. It's got a little magnesium, but it also has a proprietary blend of some medicinal herbs that really work well to help lower blood pressure, and in such a way that it is not too much so that you don't really have to worry about falling blood pressure, but it does just kind of take that little edge off if you're just really borderline, or if you're just even running, say, 130 over 85, which is still many would consider borderline. So you want to try to keep that pressure, if you can, under 120 over 80. And so this Carditone, we've just been very pleased and very happy with how it seems to work. Not that you shouldn't see a doctor, not that you shouldn't follow up, but it does seem to be a great benefit, and we've seen good results with that. The other things that can be helpful are just having less alcohol, cutting back on caffeine, although there seems to be some improvement with coffee itself, but you just don't want to do too much. And then we are left at the end, if we're not very successful, looking at medications, which are very effective. And even though I'm not huge on a ton of medications for folks, I certainly believe that they are very valuable and very beneficial and necessary as part of our toolbox for managing folks with hypertension. So hopefully that's given you a little bit of an overview. And if you have some questions or concerned about your blood pressure, please let us know. But I think it requires us, first of all, just to accept the fact that with aging, that this is not an uncommon finding. And with these borderline pressures, you want to look at it, not just ignore it. You really want to address it. And we have some tools that can be quite beneficial. Hope you all have a great week, and we'll be talking again next week.